Nurses Serving on Boards is the episode topic. My guest is Dr. Nancy Mannion, Chairperson elect of the Nurses on Boards Coalition and President of NMB Global Leadership. So let's get started.
Welcome to the BRG Nurse Executive Podcast. BRG is a global consulting firm that helps organizations in disputes and investigations, corporate finance, and performance improvement and advisory. BRG's healthcare performance improvement practice offers multidisciplinary services to healthcare organizations. We focus on implementation with innovative, independent, and data-driven solutions. In the BRG Nurse Executive Podcast, we discuss improving patient care by advancing nursing leadership. For more information about BRG, please visit thinkbrg.com. Now here's your host, Nick Shimolewski.
Nancy, thank you so much for joining us today.
Delighted to be here, Nick.
And so tell me a little bit about the Nurses on Boards Coalition.
The Nurses on Boards Coalition really came out of a Future of Nursing report, and it was determined that the health of our communities really could be impacted by having nurses serve on boards. And so that became our mission statement. And it's become the work that we do is to really look at the impact that nurses serving on boards can have to really improve the health of our communities here in the United States, but also around the world.
What are some examples of various different boards where you've been able to place nurses?
One of our partners is the American Association of Retired People. And they have opened up opportunities across the country for nurses to serve on local boards. They have boards dedicated to aging, like age-friendly communities. They have veterans groups that are specifically for those who have served in the military, and they are really dedicated to healthy aging. And it mirrors and matches very closely with our mission of improving health in the communities. And so they've been a wonderful partner. We've had nurses serving in age-friendly communities in several states for years. And they really bring that perspective of a nurse and of health and well-being to the decisions that are being made by boards. And that's powerful when you think you can replicate that around the country.
What kind of experience should someone have as a registered nurse if they're looking at potentially serving on a board?
Nick, that's a great question. There are lots of levels of board service and lots of levels of boards. So small local community boards, for example, Pop Warner Football, Meals on Wheels. I think that a nurse who has some experience and probably very stretcher side experience would be an ideal candidate for serving on a local board like that. They know their community. They may have children involved or elderly parents in that community, and they really understand the needs of what people need. But they also bring the perspective of what is good health and helping to make sure things like injury prevention are addressed, both for children in a sporting activity or for elders who are at home, and looking at nutrition and food security in your own community. So that's, I think, an ideal opportunity broadly for any nurse who has any interest in really helping their community, looking at those kinds of boards. We also move into sort of higher level boards, corporations that have a larger impact. And this year, in 2023, we will be launching publicly an opportunity for nurses who have experience in board service to be listed as interested in corporate board service through two of our partner organizations. The goal of this is to really hope to mirror the diversity efforts that are being done by these corporate boards. There was legislation passed by the Security and Exchange Commission saying that publicly traded companies needed to really pay attention to the diversity, equity, inclusivity work and to make sure that their boards were reflecting that. And so it's a terrific opportunity for nurses with experience to register, and there's information available on the NOBC website that will be coming out in January for any nurse who's interested to be able to serve in one of these national corporations, to put their name into the bucket, so to speak, and be at a table that has a tremendous amount of influence, not just locally, perhaps on one community, but perhaps broadly across the country.
What I'm hearing as you're talking really is population health, right? And the nurse's responsibility to affect populations through decisions that these various different groups are making.
You are correct. The social determinants of health really are the framework around our strategic plan that we put in place last year. We recognize that there are tremendous needs in our community. Part of it is what we learned coming out of COVID, that there's a very fragile safety net for many people. And the social determinants of health are a really good framework for an organization like NOBC to say, how do we impact the community? Food insecurity, housing insecurity. I always say if a nurse was serving on the water board in Flint, Michigan, perhaps the issue of dirty water, contaminated water would have been dealt with in a very different way if there was someone there who was really promoting health.
Okay, so I'm a nurse and I'm interested in serving on a board. Where should I go? What should I do? What are the next steps for me to get on a board?
Go to the NOBC website and register your interest that you would like to serve on a board. And it's very prominent on our homepage, the I want to serve. And so you would fill out your information, become entered into the NOBC database, and then you'll be receiving messages, emails that come out regularly that list board opportunities. We get requests every week from organizations looking for nurses, and we post those out in our member organizations, asking for nurses who are interested to please apply for these positions. So that would be the first step. If you're a nurse already serving on a board and you haven't registered with NOBC, we want to count your membership. We want to be able to support you and give you the resources to help promote you. So if you already serve on a board, let us know if you aren't already registered on the NOBC website. And so that would be the count me as somebody on a board. I'm already serving. So there's two different pathways that a person can take. And there's a lot of resources available. If a nurse has never served on a board, we have board competency information and the whole package of what does board service mean. So there's some educational resources available.
If I'm serving on a board that's affiliated with a nursing professional organization, does that need to be counted too, or is that kind of already counted in the work that you do?
When we talk about boards that count, we're really not talking about nursing membership organizations because they are our members. And so it doesn't count in that same respect, but it's experience and it is valuable. And so we would definitely want to put that in the database. So yes, nursing organization membership and serving on nursing organization boards is something that is very valuable. And we would like to see that information.
When did NOBC start? How many people have you placed? What are your stats?
That's a great question, Nick. We're coming into our 10th year soon. NOBC currently has over 10,000 nurses who have been confirmed in a board placement through our organization. We receive requests regularly from organizations all around the country. And this year, we're tracking how many states are getting a nurse serving on their board through NOBC. 6 states have achieved the goal of 2 board seats filled by nurses through NOBC board placement. And 25% of our states have at least 1 board seat filled by a nurse. So we're excited about the growth and the potential for being able to have representation through NOBC board placements across the country.
Beyond getting on the boards, obviously quantity of we got to get the nurses on the board. What type of measurements, if any, is NOBC doing about, okay, we've placed someone, now what? And what type of impact is that translating to?
We're in the middle of doing surveys on the value of nursing on boards. We've done some research around nurses who are serving on boards and how important it is for them. And we've had some publications around that. But we're now doing research with board leaders asking them, what impact has the nurse had on your board from their perspective, not from the nurse's perspective? We have work groups that are dedicated to measuring impact of the nurses serving on board. So we do value surveys regularly to our members and ask them about the impact that they are making. We ask when a person is placed on a board to provide feedback to us on the work that they're doing and how their work is impacting the social determinants of health so that we can capture that information as part of our report.
And so, if I'm a nurse executive leading an organization, perhaps a CNO or a CNE role, obviously there's some community board service that most people in those roles are already doing. But what should that CNO or CNE do for helping instill development of their leaders to serve on boards and perhaps use NOBC? Any thoughts of how NOBC can work and align with that nurse executive?
The nurse executive can search out the resources on NOBC's website. As I mentioned, we have board competencies and resources available. We have a board preparation work group that is partnered with an organization that develops nurses to serve on nonprofit boards, which is really more of the community-based organizations. The nurse executive should disseminate this information. Talk about it at your leadership meetings. Tell people to register. And then think about opportunities that as the CNE exist in your own community and encourage and mentor those younger emerging leaders to serve on those boards. Encourage them to get involved and use the tools that we can provide to give them the skills and the competencies for them to be successful. NOBC was awarded a grant by the American Nurses Foundation to support underrepresented nurses for successful board service. So this is a very targeted grant that will be developing educational programming for underrepresented nurses, reflecting the communities that they serve in so that we achieve that diversity, equity, and inclusivity goal that is really front of mind for many of our organizations these days. So an additional resource that will be available as we develop the resources from this grant would be a way for underrepresented populations of nurses to be able to stand up and feel comfortable serving.
Yeah, what you're talking about right now reminds me of an earlier episode that we did about implicit bias in nursing practice with Dr. Anna Valdez and Dr. Lisa Wolf. And they were talking about how 80% of the nursing workforce across the United States, at least, is white. And thinking about those communities with lower social determinants of health, how do we get nurses that look like and come from the same backgrounds as those lower social determinant of health communities are to help their own communities in advance? So it's great that you have something along that initiative. How should a nurse executive also try to advance that opportunity around this? I see that NOBC is doing this, but how can we assist? What role does that look like?
When I think about the sphere of practice for the CNE, they represent nursing to the entire community, certainly at the executive level. They should be tuned in to what's happening through their hospital board in their own community. What are the social determinant of health that are primary issues for them? Is it food insecurity? How does the organization itself, as an organization, support the community? How are they reaching out to underserved populations in their community and giving them the health care that they need? And so for a CNE to look at the bigger picture of her community or his community and be able to identify where social determinants of health may be lacking, and then how can nurses be of support in achieving health in the community through service in organizations that are working toward this. So is it the local food bank? How does the nurse executive create those pathways for introductions for a nurse who's interested, who has some skills, who would be wanting to serve in that community at that level? Can the nurse executive make those introductions? Can they pave the way And I think also, very importantly, they need to lead by example. If you want your staff to serve on boards, you need to be talking about the boards that you serve on as the nurse executive and make that a norm and an expectation that your team is going to be engaged in your community to improve its health.
All right. So I've started serving on a board. Let's say that I was placed with NOBC and certainly can impact the community by improving social determinants of health. But how does that enhance an individual's own growth and development?
I'm really grateful that NOBC has developed some resources that span the novice to expert continuum. And I think these are the kinds of resources that can be very beneficial for personal and professional development. These tools can help you assess your board leadership skills and identify areas for your own growth, expansion, and advancement. And the confidence that you get when you know yourself, when you know what your competencies are, gives you the courage to apply for board service and to be able to seek increasingly more responsible board positions. And so the growth that the individual can experience through board service really is one that opens further doors simply by becoming part of a network of people, of other boards in communities or in corporations. And I think that it's really a way of advancing your own career. You may make connections and network with people that might not have been in your circle, but open up additional doorways for your own professional growth and career development.
Excellent. And so those competencies, what I heard you mention though, is they follow the Benner model of novice to expert.
That is
Okay.
correct. And I think that links back to what I mentioned, Nick, that a person who's never served on a board before might find themselves very intimidated. But taking that model of starting as a novice, what do I need to know and how do I begin? You build up some expertise and then you can move along that continuum so that as you gain more knowledge and expertise in the skills of being on a board, you can look at larger boards, more corporate oriented boards, perhaps, at boards that serve on a larger scale than a community, perhaps a national or regional kind of board.
Excellent. Any closing thoughts?
I'm really grateful for the opportunity to share about NOBC. I'm really excited about the growth that we are currently experiencing as an organization. We have 26 member organizations that are part of NOBC and reflect a broad, diverse group of nursing organizations. And really, they drive the work that happens at NOBC. So I'm really excited to be able to speak about the work that we do and really want to support nurses serving on boards. I have found it personally very fulfilling. And I think for nurses, this is a great opportunity for us to give back to our communities, but also to gain something as well.
Great. Thank you very much, Nancy, for taking the time today. What I hear that I need to do is to go to nursesonboardscoalition.org and register myself as a nurse to be able to serve on a board. And I look forward to seeing continued great things coming from NOBC in the near future.
Thanks, Nick.
You've been listening to the BRG Nurse Executive Podcast, which focuses on improving patient care by advancing nursing leadership. The views and opinions expressed in this podcast are those of the host and podcast guest and do not necessarily reflect the opinions, position, or policy of the guest employer, Berkeley Research Group, or their other respective employees and affiliates.